Firstly, I think the title of this video should be Medical Migration Australia versus UK as opposed to AMC versus PLAB. As you merely don't do exam, it's the entire lifestyle that you embrace that comes with these licensing exams. For most IMGs, the medical migration consists of passing the licensing exams, getting specialist qualification that is world recognized, better education for their children, and getting a passport that provides visa-free travel to the US, UK, Europe, and popular touristy countries, all that with reasonable savings. And I don't think that's entirely unfair. When I graduated from medical college in 2001, the top and the talented either moved to UK or US. Australia was not even on the consideration list. When I came to Australia, it appeared that migrant doctors over here are mostly from UK or migrant GPs via the AMC route. It's because in 1990s, the doctorate had negative points in migration in the health system. Health system was so well serviced that they did not need doctors here, I guess. In the last 10 to 15 years, the IMGs here are mostly women married to migrant workers, and most of them were stay-home moms or GPs. Come COVID time, when most of these doctors were now required to enter into the workforce, these migrant lady doctors were readily available and with a bit of an effort got into the medical practice, which sent waves of encouragement and motivated all the doctors in India, Sri Lanka, Pakistan, and much of the Middle Eastern countries, and hence the shift. Now we're seeing new shift in Australia with migrant doctors wanting to come to Australia because of the crisis situation in the UK with NHS staff shortages and burnouts and poor salaries. And also in the US, where 40% of the IMGs are not able to get a match. Brand new migrant doctors in subcontinent Middle East have now got a third option. They are now comparing PLAB with AMC or UK with Australian lifestyle. And yes, as borders open and most developed countries are in the race with each other, calling out for skilled migrant workers, Australia responds by easing visa rules and fast-tracking some of these skilled workers, a trend which I think is very favorable for the next 3 or more years even. Now for this video, I'm going to compare AMC and PLAB in following categories. Number 1, real cost of exam. Number 2, availability of venues for exam. Number 3, pass rate. Number 4, job and training and specialty opportunities. Number 5, financials. Number 6, working conditions. Number 7, lifestyle. And number 8, my conclusion based on all of these factors. But let's first take a step back. Let's burst the first myth about the competent authority pathway, because I get a lot of questions in this regard. The question I get is, sir, I intend to do PLAB and then come to Australia via the competent authority pathway. This is absolutely fine. In fact, this remains the most well-trodden registration pathway for migrant doctors from the UK. But statistically, the doctors in this category are UK medical school graduates or British citizens or predominantly white doctors. The migrant doctors from Pakistan or India who initially went to the UK and then came to Australia are very few compared to the white British graduates coming to Australia. Also, I think whenever you take PLAB or USMLE or AMC, one requires to be committed to a system. When you pass PLAB and get your first job, then later join the training program, for majority of migrant doctors, they will adjust and continue with that pathway, no matter the hardships. This is especially true if you have wife or a partner who might be a professional involved in a job and kids who are going to school and well adjusted into that system. But what about the fresh migrant graduates without any family commitments who have passed PLAB and after working in the UK for 12 months, they might be single or they may have young families. Now that is exactly fine. I in fact belong to the same category when I came to Australia, and I would say this category is much more suited to come via the competent authority pathway. But the word of advice, please don't come here for money's sake. When I came to Australia, I was very clear that I would like to join emergency medicine training program. Please don't do PLAB for coming to Australia, but rather do PLAB and explore every training and development opportunity. And if you're not getting anywhere, then yes, Australia will provide that seamless transition. Number 1, real cost of exam. I call it real to factor in the time and cost. For AMC, you will build a portfolio to get EPIC verification, which is about $600. AMC 1 cost about $2,920, and AMC 2 will set you back $4,130. English test about $550. So overall cost is about roughly $8,000 to $8,150 Australian dollars. Now for PLAB, the OET is about £320. PLAB 1 is about £247. PLAB 2 is $320. So overall cost is about £1,473 or about 2,696 Australian dollars. However, there's a catch. Unlike PLAB, you do not need AMC Part 2 to get the job. So the cost to get registered after the AMC exam comes down to $4,000, which is roughly twice that of PLAB cost. It's very clear PLAB is a clear winner here. Availability and venue of exam. As of 18th March 2023, GMC is inviting PLAB on registration for 12 to 18 months ahead. So going into February to May 2024. There's a mention of some dates availability in November if they've got capacity to do so. So the doctors who are deciding to book PLAB now will have to wait for at least 12 to 18 months. AMC Part 1 dates are available monthly. Now AMC Part 2 and PLAB 2 dates are equally difficult to get. But as I said before, for AMC, you do not need an AMC2 passed to be able to get a job. In fact, in the last 24 to 48 months here in Australia, more doctors are registered after passing AMC1 only, as you may be able to completely bypass the AMC2 by workplace-based assessment programs. So it seems AMC is a clear winner here. Exam venues. Both AMC1 and PLAB1 can be taken across multiple centers throughout the world. However, AMC1 is a computer adaptive test conducted by Pearson VUE, and there seems to be a lot more centers to conduct this test across the world compared to PLAB1. AMC2 is only conducted in Melbourne and PLAB2 is only conducted in Manchester. So AMC is a clear winner here. Not only there are more dates for AMC Part 1, but you are able to apply for jobs immediately after. Now exam pass rate. For the sake of numbers, AMC 1 has a 50% pass rate compared to that of PLAB 1, which has about 65 to 70% of pass rate. But there's a catch in these numbers. We have to compare apples to apples. The top and the talented overseas medical university graduates take PLAB and USMLE, and hence these exams reflect an extremely good passing score. In my personal observation, in the last 5 to 7 years, AMC1 exams taken by people with large career gaps, predominantly lady doctors trying to return to workforce after marriage or family build-up. And for them, a pass rate of 50% is amazing. I did my own AMC Part 1 exam with 3 weeks of preparation with full-time emergency resident work and 3 days study leave only, and managed to pass with ease because all the questions in AMC exams are practice-based medicine. PLAB 2 pass rate is about 45 to 55%. AMC Part 2 pass rate is half of that at about 30%. But now AMC is not publishing the recent data. But I would maintain, when I've worked with some of these doctors through our AMC clinical course, they clearly lack the experience, and hence it is reflected in that poor pass rate. As I said, good thing is that you don't have to take AMC2. Even though it may look like that PLAB is a winner here, factually I think this is a tie because we're not comparing apples to apples. Job and training opportunities and choice of specialty. UK has more openings for IMGs in both training and non-training position. Australia has low overall training positions, but it is also harder to get into some of the most competitive specialties, especially like surgical specialties, neurosurgery, cardiothoracic surgery, orthopedic surgery, plastic surgery. In Australia, although you can get into a job through a visa, you need a full registration and permanent residency to start joining the training programs like in emergency medicine, ICU, medical programs, surgical programs, which may take about 12 to 18 months after your first job. And obviously you have to have passed the AMC2 or have completed the WBA to be able to lodge an application for permanent residency. Now, I've included various links in the description to check for the competitiveness of various specialties here in Australia. So click the link to get more accurate description. I think in terms of training, it is very similar in the UK and Australia, but with extreme stressful situation and burnout in the NHS, the training could have been affected. The other thing is, in Australia, the trainees are very well supported. The junior doctors are encouraged to run everything past their consultant. There are also training support positions like DPET or pre-vocational training supervisors in every hospital, and they are there to support trainees, ensure their well-being, and this is a big part of work culture here. From my own experience, the comments from the trainees in particularly emergency medicine who come in from the UK to join the Australian system is much more thorough, and it's not like a quick referral or triage system like that in the UK. There's also much growth and demand in specialties like emergency medicine, ICU, pediatric psychiatry, acute medicine, geriatric medicine, and general practice in Australia. So overall, in terms of job and training openings, UK is better compared to Australia. I think PLAB wins here due to more openings. Financials. This is perhaps the most important decision factor for IMGs to consider Australia these days. Average salary for a first year resident in Australia is about 120,000 Australian dollars compared to that of a UK FY2, which is about $70,934. Consultant salaries in Australia is also 2 to 3 times higher compared to that in the UK, which is why many senior doctors and GPs like to migrate and settle in Australia. There is also a lot of private practice here. This obviously increases the take-home salary. So Australia seems to be much better compared to the UK when it comes to financial. So Australia or AMC route is a clear winner here. Working condition. Perhaps the most important reason to choose between Australia and the UK could be the working conditions. Now, I'll tell you about my own personal example. When I was working as a junior doctor in NHS, as an SHO in Alexandra Hospital in Redditch, in ED in 2005, I used to be the only junior emergency doctor from 2 a.m. till 8 a.m. I would run head over heels, putting cannulas, catheters, working recess, calling specialty doctors in the morning to have the patients admitted, who would want everything done for their patients. This is well before COVID, but I sensed the cracks in the system. And soon after that, I left for Australia. NHS staff crises have steadily worsened since then, and especially after 2018. And these are due to the key factors. Number one, Brexit, limiting the European doctors coming and working. Number two, lack of pay rise. Number three, staff leaving due to stressful situations created by COVID and vicious circle of staff shortages and stressful situation. Nuffield Trust, which is an independent think tank, published a report late in 2022 showing that Brexit has left NHS short of about 4,000 doctors in key areas. There was also a BBC report in July 2022 that NHS is facing an overall shortage of 12,000 hospital doctors and 50,000 nurses and midwives. This is mammoth number. Various surveys and the polls in the UK, medical staffs are feeling overworked, underpaid, unappreciated, and they lack supervision. Some of my colleagues working in emergencies told me that average wait time in ED could be as much as 12 to 16 hours. And definitely with these staff deficiencies, the training and well-being of all staff are at stake, if not short-term, then long-term. So what about Australia? How's the health sector coping here? As per Australian College of Emergency Medicine, which recently put out a report, emergency only, there are 28% specialist trainee positions vacant, 30% junior doctor positions vacant, and 10% senior doctor positions vacant. Now, there are days in emergency where the wait list would be unmanageable and the days when it seems to be okay. It's fair to say that Australia health staff shortages are not as bad as NHS. Australians have been very quick in realizing that they are no longer getting doctors from the UK and Ireland due to COVID restrictions, so they started to hire local IMGs. And gladly that trend continues along with opening of the borders and somewhat eases the pressure. However, the nursing shortages and aged care sector shortages are still there, and these are the worst hit sectors. The population here is also less compared to the UK, and there is also a private health setup and takes a bit of a pressure away. In the last 1 year, I've had consultant emergency doctors contacting me from the UK, Qatar, wanting to get job in Australia. At this stage, Australia seems to be doing much better compared to the UK. So AMC or Australia takes the score here. Lifestyle and living conditions for professional doctors. This can be a very personal thing, but Australia is a huge country with 80% of the population in coastal regions. So lifestyle here is more laid back, outdoors, and couple that with excellent weather. The wages here are generally high, and overall quality of living is amongst the best in the world. Migrant communities are also well established now. There are large communities of Chinese, Middle Eastern, South Asians, British, European migrants, so new migrants don't feel alone. They feel in fact more welcome. In the last 10 years, I have noticed Australia has become much more accepting of new cultures, migrants, and religion. There seems to be concerns that Australia is very far away from the rest of the migrant and tourist countries. I think this is somewhat biased and not true. Sydney and Melbourne airports are now the busiest airports in the region. Sydney is now building another airport in the west, which will take over the Sydney airport in terms of its operational capacity by 2030. Most capital city airports have direct flights to major connecting hubs like Dubai, Singapore, and much of the Europe. The tourist destinations nearby are different. They are Malaysia, Thailand, Singapore, Japan, South Korea, Indonesia, and New Zealand. So I think it's somewhat different compared to the localization. UK is also a migrant country with very well-established migrant communities. It's closer to Europe and it's also close to the US, and much of the subcontinent countries are directly linked to the UK Heathrow Airport. However, the wages and poor working conditions and weather makes the overall lifestyle somewhat meaningless. I mean, you can be happy if you don't want to know that there are better options. Overall, I think Australia definitely takes the cake here. My conclusion, if you're fresh and young junior doctor who wants to get out of the country of origin after the internship or first year of residency, then UK would be a better option. I mean, if you're young, you're most likely single and you don't mind a bit of an extra work. So then PLAB would work out for you. However, you do have to be mindful that there are no dates of PLAB for another 18 months or so. And yes, you can still decide to come here via the competent authority pathway if you don't like the UK. But the question is, will you? As we as humans are the creatures of habit, and statistically, as I said in the beginning, migrant doctors who have done PLAB coming to Australia via the competent authority pathway from them, they are far less compared to the British medical graduates. However, if you have good 2 to 3 year experience after the internship and want long-term professional and financial stability with relaxed lifestyle, then you cannot go wrong with AMC in Australia. I hope I've generated enough discussion to help you decide whichever pathway is more suited for you. Obviously, this is not a unified or a gospel piece of advice. You are more than welcome to do your own research and factor your own personal circumstances. Take care of yourself and look after each other. Thank you very much.